So, good morning, sir. My name is Kikimnes Alcoba. I'm your PT for today. So, before we start, may I ask for your name, age, and birth date for verification purposes only. Okay. So, what we're going to do today is that we're going to do the Rhodes approach for facilitation and inhibition techniques. So, before, at some point, sir, I'm going to touch you. Will that be okay? Okay. So, before we start, I want to take your vital signs, sir. So, the blood pressure, um, pulse rate, respiratory rate, and temperature. So this is the sphygmomanometer and the stethoscope used to take your blood pressure, thermometer for uh, temperature. So assuming that assuming that the vital signs have been taken and everything is within normal limits, I will now proceed. So what we're going to do today is the light moving touch facilitation technique. So this is to increase the arousal and the withdrawal response. So this is used for patients, sir, that has flaccid muscles, and then contraindications are people with unstable ANS. So this is the tool I'm going to use, sir. This is the brush. So I'm going to stroke it 5 times with 30-second rest between each stroke. So assuming that this is a table, sir, so I want you to sit down there, sir, and then place your hand on this table. So I'm going to be positioned beside the patient. So now, sir, I'm going to start na, sir, ha? Okay, I'm going to stroke na, sir. Okay, 30 seconds again, sir. 30 seconds again, 30 seconds again, and last time 30 seconds again. What we're going to do today is fast brushing, sir. So this is to facilitate in movement response and enhances the postural muscles. So this is for patient with flaccid muscles, and it's contraindicated over dermatomes C2, L1 to L2, S2 to S4, patient with brainstem injuries, and pediatric cases, sir. So now, sir, assuming that I have battery automated brush, so sir, this is the tool I'm going to use, sir. So assuming that this is a table, so sir, I want you to sit down, sir, and I'm going to be beside you. So I want you to place your hand on the table. I'm going to place this brush for 5 seconds with 30-second rest. What we're going to do today, sir, is eye icing or quick icing. This is to facilitate movement and for ANS response. So this is for muscles that are hypotonic, and this is contraindicated on the areas on the pinnae of the ear and at the back at the level of S2 to S4. So I want you, sir, to sit down there, and then I'm going to sit beside you. So assuming that this is a table, so I want you to place your forearm here. Okay, so now, sir, this is an ice, sir. Assuming this is an ice. So I'm going to swipe it on your forearm 5 times, sir. And then with each swipe, sir, I'm going to blot it with water. Okay. So what we're going to do today, sir, is sea icing. So this is to improve breathing pattern, voice production, and general vitality. So this is used for patients that has flaccid muscles, and it's contraindicated over the pinnae of the ear and at the back at the level of S2 to S4. So I'm going to use the ice cube, sir, and then I'm going to place it on your forearm for 5 seconds, sir, and then blot it with water. So I'm going to position you in a sitting position, sir, and I'll be right beside you. So assuming this is a table, sir, I want you to place your hand here, and then now I'm going to place the ice cube for 5 seconds, and then I'm going to blot it with water. So what we're going to do today, sir, is approximation or heavy joint compression. So this is to facilitate in contraction combined with developmental patterns for stability. So this is for people who have sensory regulation disorders and who has difficulty with self-regulation. So this is contraindicated on fractures, dislocation, and joint inflammation. So assuming that this is a weighted cuff, sir, so I want you, sir, so this is the tool I'm going to use, sir. I'm going to wrap it around your forearm for 5 times. So sir, I want you to be seated there, sir, and then I'm going to be right beside you. I'm going to place this table, sir, here. Place your forearm, and now I'm going to wrap this cuff around you for 3 to 5 times. So, sir, what we're going to do today is vibration. So this is used for tactile stimulation to desensitize hyper sensitive skin, and it also evokes a tonic holding contraction and adds to strength of muscle. So this is used for people with neurologic conditions, sir. So I want you, sir, to be seated there, sir, and I'll be beside you. So this is a table, sir. I want you to place your hand here. So this is my vibrating device, sir. So I'm going to place it on your forearm. I'm going to place it there for 2 minutes and will be set for 150 hertz, sir. So I'm going to place it now, sir, on the muscle belly. So what we're going to do today, sir, is resistance technique. So this is to stimulate both the primary and secondary endings of the muscle spindle, and then this also this is used for people that has tight muscles, sir, and these are contraindicated with people that has fracture, soft tissue injuries, and muscle weakness. Okay, so I want you, sir, to sit down there, and I'm going to be beside you. So this is assuming this is a table, sir. I want you to place your arm there. I'm going to place resistance in your hand to test your biceps muscle, and then I want you to flex your elbow. Okay, now, sir, we're going to do this 3 to 5 times. Okay, when I say now, sir, you contract. Okay, now. Okay. So what we're going to do today, sir, is quick stretch, sir. So this is to provide an intermittent mechanical stretch to the muscle to evoke a stronger response, sir. So it also evokes a stretch reflex without conjoint attempt to move or hold a position that is not therapeutic. So this is contraindicated for people with muscle, tendon, or bone injuries or laxities and spasticity. So, sir, I want you, sir, to sit beside me. Okay, and then assuming that this is a table, so, sir, I want you to place your arm here, sir. So what we're going to do, sir, is I'm going to place resistance here, sir, and then you're going to flex your elbow, and then, sir, I'm going to tap vigorously on your biceps muscle, and then 3 to 5 times, sir. Okay, sir, when I say now, you contract, you flex, sir. Okay, now, and now. So what we're going to do today, sir, is the intrinsic stretch. So this promotes stability of the shoulder region or the scapulohumeral region, so bearing more weight on the ulnar side of the hands, and promotes resistive grasp. So this is for patient with distal movement but proximal weakness, and this is contraindicated for people with shoulder instability. So I want you, sir, to be positioned in a quadruped position, sir, or like this. Okay, and then I'm going assuming that I'm going to give the patient an object. So, sir, I want you to grasp on the object. So you're going to do this 3 to 5 times, sir. Okay, so what we're going to do today is secondary ending stretch. So This is a combination of resistance and stretch to facilitate ontogenic patterns. This is used for flaccid muscles, and contraindications are fractures, weak muscles, dislocation, and muscle tear. So I want you, sir, to sit beside me comfortably, and then assuming this is a table, I want you to place your arm here or your elbow here. So from this position, I want you to move um, to this position in extension, and I want you to after that go back here. So first I'm going to place a resistance here on your first movement, and I'm going to place another resistance here in the second movement, sir. So we're going to do this 5 times, and then that's all. So what we're going to do today, sir, is the stretch pressure. So it affects the receptors and the afferent muscle spindles. So this is used on people that has a flaccid muscles, and it's contraindicated on people with tendinopathy, weak muscles, fracture, dislocation, and muscle tear. So what I want you to do, sir, is to be in a supine position, in a quadruped, sir, like this, like that, sir. So first, sir, I'm going to palpate your triceps muscle, sir. Okay, now that I've located the triceps muscle, I'm going to use these 3 fingers, sir, the index, the middle, and the thumb. So I'm going to place it here like this on the muscle, and then what I'm going to do is I'm going to apply a downward pressure over that area, sir. So I want you to hold this stretch, sir, for 3 seconds, sir. So I'm going to move my thumb away from my index and middle finger while I'm at it, and that's it, sir. So what we're going to do today, sir, is tapping. So this acts on the afferent muscles of the muscle spindles, and it also increases the tone of the muscle. So this is for people with flaccid muscle, and contraindications are people that has tendinopathy, weak muscles, fractures, dislocation, and muscle tear. So what we're going to do, sir, is I want you to sit beside me comfortably. Okay, so imagine that assuming that this is a table, sir, I want you to place your arm there like that. So as you're going to do this, sir, I'm going to tap repeatedly 3 to 5 times. Okay, so when I say now, sir, do the action, sir. So now, okay, now. So what we're going to do today, sir, is the vestibular stimulation. So this is found to activate the anti-gravity muscles and their antagonist before the stretch reflex of the muscle spindles. So this is for people that has hypotonia and irreflexia, and this is contraindicated on people with seizures, intolerance to sensory stimulation. So what I want you to do, sir, is that you'll be laying on your back with your head facing toward pointing towards me like this. Okay, so sir, I'm going to bend your head laterally, left and right, and then I'm going to move your head to the left and then to the right, and then up and down, and also I'm going to do a rotational movement. So I'm going to do this 5 times, sir, and then that's all. So what we're going to do today, sir, is inversion. So inversion increases the tone of anti-gravity muscles such as neck, trunk extensors, and lower limb extensors. So this gives better control of this muscle, and also it stimulates the CNS. So it is indicated for people with hypotonic muscles and its contraindications are circulation disorders, swollen joints, and osteoporosis. So, sir, first I'm going to place you in a tilt table, sir, which is tilted 60 degrees. So, assuming that this is the table and that the patient is tilted for 60 degrees. So, sir, I will be letting you stay there for 5 minutes. What we're going to do today, sir, is osteopressure. So osteopressure relieves tension and facilitates voluntary movements. So it is indicated for people with hypertonic and irreflexive muscles. So it is contraindicated for people with fractures, arthritic conditions, and instabilities. So what we're going to do today, sir, is you're going to be in a pronated position, sir, or your belly on the bed or the table. Okay, like that, sir. So now, sir, I will be positioned beside you, and then I'm going to apply pressure on the elbow for 2 minutes. So now, sir, what we're going to do today is that we're going to do neutral warmth, sir, which is an inhibitory technique. So this is used for relaxation and to decrease the muscle tone. So in that sense, it is indicated for people with hypertonic muscles. So sir, I want you, sir, to be lying on supine with your back against the bed, so like that. And then I'm going to give you this blanket, sir. I need you to wrap it around you, sir. So assuming that the patient is wrapped around the blanket, so sir, I'm going to you're going to wait for 10 minutes, sir. So what we're going to do today, sir, is we'll be doing gentle shaking or rocking inhibition technique, sir. So this is to decrease muscle tone. So this is used on people with spastic muscles, and contraindications are fractures and dislocations. So now, sir, I want you to be in a supine position wherein your back is against the bed or the table like this, and then I'm going to be here standing. So what I'm going to do is that I'm going to rotate the head of the patient gently and slowly, and then I will stop until the relaxation is achieved. So what we're going to do today, sir, is slow stroking. So slow stroking affects the nerve endings and sympathetic outflow of the autonomic system. So this is indicated for spastic muscles and is contraindicated for people with wounds and pressure sores. So now, sir, I want you to be positioned in a supine position, sir. I mean prone, belly against the table, sir. Okay, like that. And then I'll be beside the patient like this, and I'll be applying slow pressure using my fingers, sir. So I'm going to move from the area on the neck near the occiput towards the coccyx, and this will be done for 2 minutes. So sir, what we're going to do today is light joint compression or approximation. So this is to inhibit the spastic muscle and around the joint. So that said, so this is used for people with spastic muscles, and then contraindications are fractures and dislocations. And now what I want you to do, sir, is sit beside me, and then assuming this is the table, I want you, sir, to put your hand on the table, and then I'm going to apply pressure that is less than or equal to the body weight of the hand, since it's just light light compression. And then I'm going to perform this compression for until the muscle relaxes. So what we're going to do today, sir, is tendinous pressure inhibitory technique. So this is to reduce the spasticity of the muscle through the application of firm pressure, and then this is for spastic muscles or tight muscles. So first, sir, I want you to sit beside me, and then assuming this is a table, I want you to place your hand on the table. So I'm going to palpate the muscle here, which is a wrist extensor, flexor, and then from there I'm going to apply pressure, firm pressure, for 2 to 3 minutes. So what we're going to do today, sir, is the maintained stretch inhibitory technique. So this is used to facilitate the muscle contraction, which is directly proportional to the resistance applied. So this is for people, sir, that has muscle fatigue. So sir, I want you to be in a supine position, sir, wherein your back is against the bed, and then your right hand is dangling. Okay, so like this. So I'll be standing beside you, sir, and then I want you to straighten your hands, sir, like that. Okay, let's just let it dangle for 20 seconds, sir. So after 20 seconds, it's done.